This podcast is part of the Bible-thumping Wingnut Network, Biblical Christianity's marketplace of ideas. BibleThumpingWingnut.com.
All right, folks. Breaking news out of the World Health Organization. How do we know when science has come to proper conclusions? How do we know when they've come to proper conclusions? I believe we can know when science has come to proper conclusions because it agrees with Scripture. Let me make my case. We have been on lockdown, quarantine. The healthy have been quarantined for 6-8 weeks. And now the World Health Organization has come to a new conclusion. Scripture is correct. What does Scripture say about quarantine? Leviticus 13:46. He shall remain, talking of people with leprosy, people who are sick, he shall remain unclean as long as he has the disease. He is unclean. He shall live alone. His dwelling shall be outside the camp. And we know from the New Testament scriptures as well how folks with leprosy were treated, right? They were outside the camp. The sick were quarantined. The sick were put away until they got better. They were separated from the healthy people. The scripture makes it clear that healthy people don't get quarantined. Sick people do. And the World Health Organization and the United States health organizations have said, hey, we need to quarantine everybody, which goes against Scripture completely. And the impact of this anti-scriptural approach to a disease has been devastating to people, to countries, to economies, to our welfare, mental states. And now, as I watch the news tonight, with great frustration, as usual, I try not to watch the news, but this is shocking. Breaking news. Tom Giannis reports 17 seconds. 17 seconds. They devoted 17 seconds to this breaking news. Let me turn this up. I think I have to turn this up for you. Suddenly, the World Health Organization has a special announcement.
And tonight, new important guidance from the WHO. They're now saying it is rare for asymptomatic patients carrying COVID-19 to spread the deadly disease. They say the focus should be on people showing symptoms to quarantine them and isolate their contacts. David?
Wow. Did you hear that? Quarantine the people who are sick. He said the people who don't have symptoms, those people rarely spread the disease. They rarely spread the disease. We need to focus on the people who are actually showing symptoms of being sick, and those people need to be quarantined. Exactly what Scripture says. Let me play it for you again.
And tonight, new important guidance from the WHO. They're now saying it is rare for asymptomatic patients carrying COVID-19 to spread the deadly disease. They say the focus should be on people showing symptoms to quarantine them and isolate their contacts. David?
There you go. So I listened to NPR throughout the day to keep me awake as I'm working. I drive truck for a living. I hadn't heard anything about this all day. So I did a little bit of a search, and what do you know? If you search on Google today, World Health Organization says asymptomatic. That means you're not you test positive, but you don't show any signs at all, let alone you're healthy and you're not sick. That doesn't need to be the focus, they're saying now. They're saying, finally, they're saying that. Asymptomatic spread of COVID is rare. Actually, she's going to say very rare when we play the clip. CNBC, asymptomatic spread of coronavirus is very rare. And so let's go see what they actually said. What did she actually say? Now, okay. Where's the conspiracy theorists? Because this YouTube channel is CNBC television. CNBC television. Highlight it. Well, oops, I can't highlight it. Right now, right over there. Right there is the name of the YouTube channel. CNBC television. The name of the video is "Do Not Make Public." The conspiracy theorists, why probably jump all over that, right? Do not make this public. That's weird. That's the name of the video. But anyway, it's 3 minutes long. Let's see what she said. This is the World Health Organization official.
We hear from a number of countries that X percentage of them are reported as not having symptoms, or that they are in their pre-symptomatic phase, which means it's a few days before they actually develop severe symptoms. In a number of countries, when we go back and we discuss with them, one, how are these asymptomatic cases being identified? Many of them are being identified through contact tracing. And so, which is what we would want to see, in that you have a known case, you find your contacts, they're already in quarantine, hopefully, and some of them are tested, and then you pick up people who may have asymptomatic or no symptoms or even mild symptoms. The other thing we're finding is that when we actually go back and say how many of them were truly asymptomatic, we find out that many have really mild disease, very mild disease. They're not quote unquote COVID symptoms, meaning they may not have developed fever yet, they may not have had a significant cough, or they may not have shortness of breath, but some may have mild disease. Having said that, we do know that there can be people that are truly asymptomatic and PCR positive. The second part of your question is what proportion of asymptomatic individuals actually transmit. So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare.
Very rare. Very rare. All of us who've been staying home, all of you who have been staying home, all around the world who are not showing any symptoms. You can even have COVID-19. You could have a mild case of COVID-19 and show no you're not coughing, you don't have any of the other symptoms, you don't have shortness of breath, all those other things. You're not contagious. They're saying you're not contagious. Obviously, if you're not sick, you're not contagious. And even if you are sick, you're not contagious unless you are showing signs of being sick.
And that much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be
in other words, if you don't have symptoms, you don't have to stay home. That should have been the practice. That should have been the practice everywhere. As the scripture says, the people who are sick, the people with leprosy, quarantine those people. Quarantine those people. That's what scripture says. And now the World Health Organization is saying, if you're not sick, even if you are sick, if you're not showing any symptoms, you're not contagious. You can't get other people sick if you're not showing any symptoms. if we did what Scripture said and quarantine the people who have symptoms, we would have been doing what they now say is the best response. The best response that the World Health Organization says today comports with Scripture, comports with what Scripture says. So we can conclude that today they have come to a right conclusion because it's what Scripture says. If tomorrow they say, oops, we were wrong with what we said, and the people who aren't showing symptoms, they can get other people sick, well, that doesn't comport with Scripture, does it?
Focused on is following the symptomatic cases. If we followed all of the symptomatic cases, because we know that this is a respiratory pathogen, it passes from an individual through infectious droplets. If we actually followed all of the symptomatic cases, isolated those cases, followed the contacts and quarantined those contacts, we would drastically reduce. I would love to be able to give a proportion of how much transmission we would actually stop, but it would be a drastic reduction in transmission. If we could focus on that, I think we would do very, very well in terms of suppressing transmission.
If we focus on the people who are actually sick, we will lessen the spread of the disease.
But from the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
Wow. So that is where Tom Llamas, L-L-A-M. Anyway, this guy from ABC News, 17 seconds they gave to this big breaking story.
And tonight, new important guidance from the WHO. They're now saying it is rare for asymptomatic patients carrying COVID-19 to spread the deadly disease. They say the focus should be on people showing symptoms to quarantine them and isolate their contacts. David?
There you go. There you go. Trillions and trillions of dollars have been spent to help people who do not show any symptoms, to help us because they told us not to go to work, to help us because they told us, stay at home. I don't know how long it'll take for our economy to recover from the disaster that we have made for ourselves. But I do know the Scripture is true, and that Scripture says quarantine the people who are sick, not the people who are healthy. And now the WHO is not only agreeing with what Scripture says, they're saying, hey, even if you are sick, if you're not showing any symptoms, you don't have to be quarantined. You don't have to be quarantined. Our focus needs to be on the people who are testing positive and they're showing symptoms of being sick. 1500 BC. So that's 15, 25, 3,500 years ago. Leviticus 13, verse 46 was chiseled out in stone or written on some papyrus or something. I don't know what it was written on. But Leviticus 13:46 says, quarantine the sick. That was 1,500 years before Christ. We're 2,000 years past that. So 3,490 years ago, what was best for us to respond to this pandemic was written down. And not until the 17th century, not until the 17th century did scientists conclude, hey, we should kind of separate the sick people from the healthy people. There were a whole bunch of plagues in the 14th century where the people who were either dead or dying of crazy pandemic diseases. I did some research. I wrote them down. I can't pronounce them. But anyway, all these illnesses, they weren't quarantining even the sick. And people were getting all the family members were getting sick because they were keeping the sick people in with all the families. So separate the sick people from the healthy people. Don't keep the healthy people quarantined. Let the healthy people go about their business and quarantine. Focus on the people who are sick. One more time, Tom Llamas, and then I will end this. Subscribe if you haven't already. We do all kinds of stuff here on this YouTube channel. Podcasts, hangouts, roundtable discussions, yada, yada, yada. Check out BibleThumpingWingNut.com.
And tonight, new important guidance from the WHO. They're now saying it is rare for asymptomatic patients carrying COVID-19 to spread the deadly disease. They say the focus should be on people showing symptoms to quarantine them and isolate their contacts. David?
Tom, yeah.